Good afternoon. This is Robert Hopkins, team leader of Team B, presenting The Silent Killer, Women and Cardiovascular Disease. In today's presentation, we'll be speaking about the leading chronic disease in developed nations for women. Cardiovascular disease has become the #1 killer of women in developed countries. Today's health stats note a decline in CVD deaths, but with these deaths, women have not decreased like the men. Particularly coronary disease and stroke remains one of the highest chronic diseases in today's healthcare world. When discussing cardiovascular disease in women and overall our society, we must understand the risk factors of this chronic disease. Men develop CVD at younger ages, but its incidence and prevalence is only equalized for women after menopause. We must understand that sex, age, genetics are huge risk factors for this CVD. At one time, hormone therapy was utilized for and to prevent CVD. But because of increased rates of trophonic events, i.e. myocardial infarction and stroke, as well as breast cancer, hormone therapy is no longer being used. We must understand that race and ethnicity together affect CVD risk. One of the prevailing factors is African American women is almost 40% higher than that of Caucasian women to have CVD. We must understand we need to keep our eyes on the risk factors, especially some of the modifiable risk factors: diabetes, hypertension, obesity, and stress. These factors affect the risk of cardiovascular disease for women. To understand cardiovascular disease, we must understand the signs and symptoms that women can have. Understanding these signs and symptoms is paramount to preventing and providing interventions. Some of the biggest concerns that women have is that they do not display sudden sharp pains like men. The female tends to have subtle, mild discomforts, fatigue, dizziness, fainting, sometimes even just nausea and vomiting. These symptoms and signs are prevalent in cardiovascular disease. One of the comparisons between men and women is a biological factor that women's plaque and the arteries and vessels are often softer and more pliable, thus providing the subtle signs in cardiovascular disease. With these signs and symptoms, the female must understand their body. Understanding the warning signs and where these warning signs are coming from will be an indicating factor of importance for proactive interventions towards this disease. In 2013, an estimated 43 million women are affected by cardiovascular disease in the United States. With this, there's over 400,000 deaths each year that are contributed to cardiovascular disease. We must choose to enlighten our women to the causes, risks, and ultimately the final outcome if they do not manage this disease. One of the ways to enlighten our women is to reinforce campaigns that bring the disease to the minds of the public. One of these campaigns is Go for Red for Women. The second item we need to do is educate. Our healthcare providers, government, and individuals themselves are in desperate need of education. Education in 2014 has become a hot topic for the government, which has now been given new monies for education towards heart disease. Because of this great education and new monies, we must then empower our women to become preventative thinkers, to prevent and notice the high risks of heart disease. Some of the risks of heart disease are simply here just laid out in this slide, the 5 steps to beat the odds. Know your numbers, know your heart, follow your doctor's orders, get a move on. Our society needs to continue to exercise and become more prevalent in exercising every day. Tweak what you eat. Our dietary and nutritional systems are becoming more and more processed foods and high in carbohydrate processes. Please tweak what you eat. And lastly, quit smoking. If you are smoking, stop it. Smoking is one of the highest risks for cardiovascular disease for women. Making the change. Every 60 seconds, a person in the United States dies of cardiovascular complication. Currently, our public support programs make up less than 3% of our public health budget. The American Heart Association produces biannual guidelines based on scientific data collected over periods of time. These guidelines are to reduce disability, death, and risk factors such as high blood pressure and cholesterol. The American Heart Association also, with public health experts, family physicians, and community, schools, and businesses, are all stakeholders in working together to reduce CVD. They do this by implementing no smoking policies, promoting good eating habits and active lifestyles. By working together, we can implement the 3 E's, which enlighten, empower, and educate our public. One of the high points of cardiovascular disease, and maybe a great indicator of why we need to find better ways to educate, empower, and enlighten, is the overall estimated direct and indirect costs of this disease. It is noted that coronary heart disease factors in $108 billion in 2010 for our society. That's a pretty big reason to put more emphasis on cardiovascular disease, especially for women. Enacted plans that support community health. Health and wellness are influenced by places in which people live, learn, work, and play. Communities, including homes, schools, public spaces, and work sites, can be transformed to support well-being and make healthy choices, which can prevent heart diseases such as CVD. With a strong community that provides awareness and preventable treatment, heart disease is less likely to dominate a population. With all the enacted plans of cardiovascular disease in the communities, government, public places, women need to take a look at the whole picture. Look at this map. Look at the prevalence of women ages 35 plus with heart disease death rates in between 2008 2010. That's a pretty scary figure. Please look at where you live and understand your risks of cardiovascular disease. With cardiovascular disease, we must understand there are laws and regulations that are in place to ensure the safety. In this decade, the prevention of cardiovascular disease and regulating the chronic disease is a daunting challenge. The federal government has implemented multiple platforms to assist with the treating and quality of care of cardiovascular disease. Unfortunately, the prevention of this chronic disease falls onto the individuals who are handling their health decisions. With these decisions, the FDA has created some disclosure laws for preparation of foods and placed mandates on food operations to disclose calories, fats, etc. onto their menus. Our society has the choice to either prevent and live healthier lives and to allow themselves to be healthier. Our federal government is in the position to provide penalties for lack of quality of care. But today, it still falls onto the public to choose the best health decisions for their cardiovascular disease. It is vital today to know we must have confidence and we must accreditate our quality health care providers. It is vital that physicians and programs dealing with cardiovascular disease are proven competent to do so. The Joint Commission and the ACC are great examples of the bodies that set standards and continuously monitor and compare the given tools needed for cardio specialists to improve on the quality of care. Accreditation is a good way to make sure those families with heart conditions or at risk get the proper care to reduce the disability and death once cardiovascular disease is recognized. Our numbers of cardiovascular disease have improved. It is important progress that we have noticed has been made, but is needed to continue to save lives. Please look at the graph and see where the numbers are going. We are making great strides, but today we need to mobilize, encourage, and collaborate with all of our members of society, government, and public to reduce even more the cardiovascular disease in women. In our society, we must evaluate the effectiveness and the accessibility and quality of personal and population-based health services. Chronic diseases are among the most common and costly of all health problems in the United States, especially among the most preventable. Cardiovascular disease prevention must occur in multiple sectors and across individuals' entire lifespans to be the most effective. Prevention encompasses health promotion, activities that encourage healthy living and limit the initial onset of cardiovascular disease. It is essential to have a coordinated, strategic prevention approach promoting healthy behaviors. Prevention needs to support people of every age and eliminates health disparities, especially in which community-based public health efforts try to embrace. We must make prevention a priority to become a healthier nation. In this corresponding graph, it notes a strategic change in what we have been doing in health measures and interventions towards CVD. Look at how we've gone through recognizing aspirin use, then blood pressure control, and then in 2009, 2010, it was important for cholesterol management. Look how the numbers are dropping. Now the most effective has been the smoking assessment and treatments. This again reinforcing smoking as one of the paramount risk factors for cardiovascular disease in women. In conclusion, today's presentation has shown that health is not merely the absence of disease, but a lifestyle. Lifestyle choices, which includes the lack of exercise, obesity, and smoking, have contributed to cardiovascular disease, which is now the leading cause of death among women. There are numerous ways to promote prevention of cardiovascular disease in women in the United States. With this, communities can coordinate fairs with free informations and screenings. There are also programs like the Go Red program, Wise Women, the American Heart Association, and the CDC, who are all supporting our measures for preventative cardiovascular disease. It is imperative that we enlighten, educate, and empower our women so that they can recognize the risk factors, symptoms, and prevention for all cardiovascular diseases that can occur. Thank you.